Hi, my name is Kate Bloxham, and this is my presentation over mental health for the medical terminology Maymester course. So key definitions for this chapter: mental health is defined as emotional, behavioral, and social well-being such that an individual can cope with internal and external events. Mental disorders are any emotional state that causes a person to suffer emotional distress, is harmful to the individual sufferer, is self-destructive, and endangers others or the community. Affective disorders are major depression, individuals who are deeply sad for at least 2 weeks and feel hopeless during this time. Mania is the opposite extreme compared to depression, which is defined as overexcitement and impulsive behavior. Bipolar disorder is the alternation of episodes between depression and mania, which was formerly called manic depressive disorder. Approximately 6 million Americans suffer from bipolar disorder, and dysphoric mania combines the energy of mania with the dark thoughts and paranoid delusions of depression and is often considered the cause of most mass shootings. Seasonal affective disorder, abbreviated as SAD, is defined as episodes of depression during fall and winter months, which subsides in spring and summer. So anxiety disorders fall into 5 major categories, the first one being generalized anxiety disorder, or GAD. This is defined as persistent excessive worrying and uncontrollable anxiety that is not focused in one particular situation. This has to have lasted at least 6 months and allows the individual to develop fear reactions like palpitations, insomnia, difficulty concentrating, or irritability. Obsessive compulsive disorder, or OCD, is defined as obsessions are the recurrent thoughts, fears, doubts, or impulses, while compulsions are recurrent irresistible impulses to perform actions such as counting, hand washing, checking, and systematically rearranging things. The next one is post-traumatic stress disorder, otherwise known as PTSD. This occurs when an individual who's gone through significant trauma shows stress symptoms that last longer than a month. This impairs the individual's ability to function. The next one is panic disorder, which is defined as sudden brief attacks of intense fear that cause physical symptoms. This peaks in about 10 minutes or less. Finally, phobias are the last anxiety disorder listed, and this is defined as a specific situation or object that brings on a strong fear response. The danger is small, and the person realizes the fear is irrational but still experiences anxiety. Situational phobias, like agoraphobia, the fear of crowded places, acrophobia, the fear of heights, or claustrophobia, the fear of confined spaces, all involve a fear of specific situations. While on the other hand, social phobias are defined as the fear of being embarrassed in social situations, which is a very common one where people are afraid of public speaking. So, schizophrenia is defined as the form of psychosis in which there is a loss of contact with reality. They do not have a split personality. Their words are separated from meaning. Their perceptions are separated from reality, and their behaviors are separated from their thought processes. Sensory perceptions are jumbled due to their hallucinations, delusions, and paranoia, ultimately causing difficulty with concentration. This can progress to catatonia and mutism. So for personality disorders, personality is defined as an individual's unique and stable patterns of thoughts, feelings, and behaviors. Borderline personality disorder, or BPD, is defined as a frequent diagnosis for people who are impulsive, unstable in mood, and manipulative. Narcissistic personality disorder is defined as individuals have an exaggerated sense of self-importance and seek constant attention. While antisocial personality disorder are individuals who lie, cheat, steal, and have no sense of responsibility and no anxiety or guilt about their behavior, otherwise known as psychopaths and sociopaths. Schizoid and paranoid personality disorders are individuals who are absorbed with themselves, untrusting, and fearful of closeness with others. So for impulse control disorders, there's an inability to resist an impulse to perform an action that is harmful to the individual or to others. Intermittent explosive disorder is characterized by recurrent episodes of unrestrained aggression towards people or objects. Kleptomania is characterized by stealing not for gain, but to satisfy an irresistible urge to steal. Trichotillomania, otherwise known as TTM, is the repeated urge to pull out scalp, beard, pubic, and/or other body hair. Pyromania is the repeated fire setting with no motive other than a fascination with fire and fire engines. The diagnostic methods for mental disorders, there are no current ones actually, But there are a few steps that can be taken to diagnose individuals. And so they would start with a physical examination to rule out possible physical symptoms, and then lab tests to rule out other possible physical causes, psychological evaluation to determine the patient's symptoms, thoughts, feelings, and behavior patterns. And these are defined and detailed in the Diagnostic Statistical Manual of Mental Disorders. And brain imaging scans are also currently being utilized to learn more about mental disorders. So, therapeutic methods for mental disorders. Psychotherapy is talk therapy that explores thoughts, feelings, and behaviors on the assumption that the cure for a person's suffering lies within that person. There are 6 types of psychotherapy: supportive psychotherapy, psychoanalysis, psychodynamic psychotherapy, cognitive therapy, behavioral therapy, interpersonal therapy, and then here are the word analysis and definitions throughout this chapter. These are just the key ones that I'll click through. Thank you.